Okay, so Michelle, you've been a real trooper with the intake process, so I really appreciate all that you've been open about. There's another thing that we like to ask people about in terms of their recovery environment. We like to ask people about the relationships, especially how conflict gets handled in relationships. You know, we understand that this can be a really big source of support for people when they leave treatment, or it might be a really big source of stress. And so we want to try to help people figure out what's going to be most helpful for them once they are finished with treatment. So would it be okay if I ask you a few questions about your relationships?
Yeah, sure.
Okay, so I think I remember you said that you're involved with somebody now. Okay.
Yes.
Who's that you're involved with now?
His name is Wayne.
Okay, how long have you and Wayne been together?
On and off for 7 years.
Okay.
Yeah.
7 years. All right, well, so I wonder if you can tell me a little bit about what the interaction is like whenever you and Wayne have disagreements or arguments.
Well, I mean, we typically don't argue unless we've been drinking.
Yeah.
That's usually kind of when the argument starts. Usually he'll get upset about something and I'll kind of stay away, or I'll try to stay away, but he keeps picking or saying things, and then it usually leads to like a fight.
So what happens when you and Wayne fight?
Usually starts off with he says pretty mean stuff, and then I'll try to walk away, and he might try to block me from going into like a different room or trying to leave the apartment, and then it usually just kind of flies out of hands. Like he'll just keep being really mean, and I usually don't say much because I don't want to, I don't want to get a bigger fight.
So you try to kind of keep things from getting too out of control.
I try.
By just either leaving the room or maybe just trying to be quiet and not make him even more mad.
Yeah, I don't want to like put more, fuel on the fire.
Yeah.
I guess.
Yeah, that makes a lot of sense. So one of the things I'm wondering is when I totally got just messed up. Cut. Okay, so I can pick up from that point. Is that okay? Because you can just edit that.
Yeah. Why don't you give her the last tail of that response so she can pick it up?
Say it again?
Yes. I'm sorry, I forgot your name.
Dina.
Dina, give that answer again so she can pick it up right from there.
Okay, what was I saying? Oh, okay.
Try not to provoke him.
Oh, okay, yeah. Can I go now?
Sure.
Okay. I guess I try not to piss him off or say much to him. I don't want to add more fuel to the fire, I guess.
One thing I'm wondering about is if that's ever happened when you and Wayne were not drinking.
It doesn't get as bad, but it's there. There's times where, I don't know, I can say something and he just gets pissed off. He just says really mean things to the point where, I guess you start to believe it.
What kinds of mean things?
He just says how my family doesn't love me, or how I'll never amount to anything, or, my mom should have aborted me. Things that you don't say, or I don't think you should say in a relationship.
So things to really try to make you feel bad about yourself.
Oh, yeah.
Some put downs. When that happens, does he also call you names?
Oh, yeah.
Yeah.
All types of names.
All types of names. How about cursing at you?
All the time.
Yeah. All the time when you're fighting, or even when you're not fighting?
Mostly when we're fighting. He can be a sweetheart when we're not fighting. It's almost like the extreme. He's either really nice or really mean.
The Jekyll and Hyde.
Yeah.
Okay. All right. What about feeling criticized?
If I don't do things the way he the way he does it, he'll criticize it. It's like stupid things, how we wash dishes, or how you make the bed, or how you clean the house. If it's not the way he does it, he'll criticize.
So it seems like he wants to kind of control how things are done around the house. Okay.
That's the way it makes you feel.
Say it again?
That's the way it makes me feel.
That's
criticized.
The way it makes you feel, as you feel really criticized.
Right.
Okay. What about being made to feel like you're always wrong?
Well, I guess when he criticizes me on the way I do things, it makes me feel like I do everything wrong. So I just do it the way he tells me to do it.
Sure. Okay. I wonder if Wayne's ever forced you to do things that you didn't want to do?
I don't know. Probably, I guess, if we're out drinking, stay out longer or drink more, or, the last of our money to go to like drugs or whatever when we know we have to pay the rent or we have to buy food. So I guess, yeah,
Mm-hmm.
or I know it's not right, but he kind of pushes it and pushes it.
Mm-hmm. And what about preventing you from doing things that you want to do? What's that been like?
Well, it's weird. Like, if we have plans to go out, he'll like pull out of the plans right as we're leaving, so then I don't go
Mm-hmm.
because I want to stay with him. So he pulls out a lot. So that kind of, I guess that prevents me from doing a lot of things.
Okay. So these are kinds of things that we might think of in terms of controlling sorts of behaviors and the things that you were talking about before, maybe seem a little bit on the abusive side in terms of emotional abuse.
Mm-hmm.
What are your thoughts about that?
Well, I don't like to label it as emotional abuse, but it definitely, the way you've explained it makes sense that it's definitely abusive.
My first couple of thoughts would be whether there's a sense of one person feeling afraid of the other person and feeling like they don't have equal say-so in what happens in the relationship or even how they conduct themselves within the relationship and outside of the relationship.
And I think in normal conflicts in relationship, there's disagreement. We resolve that disagreement with, concepts like agreeing to disagree, and it's okay. We don't have to agree on it. We don't have to see eye to eye on it. But we're willing to compromise, negotiate, and fairness, and it's rooted in equality. Like you said, you have the right to have say-so in the relationship the same way I do. For me, where that then becomes abnormal is when then I'm not okay with your no, and I look for strategies and I look for ways to manipulate and even enrolling other people into the relationship. And even your mother says so. Even, those kinds of things, not being okay with your boundaries, with your no, because I want to get my way.
Mm-hmm.
And it's a I count and you don't perspective.
So Keisha, you had something you wanted to talk to me about.
Well, yeah, I came in, because I was thinking like maybe I need some help with, I have a lot of anger issues, and everybody's like, oh, you need to get anger management. And I'm like, yeah, okay, I don't want to hear all of that. But, basically the court told me I have to.
The court told, okay.
Yeah, they told me I have to. So, and then one of my best friends at work, I trust what she says. So, I'm snapping at her, I'm snapping at everybody.
You're snapping at everybody.
Yeah.
Okay, so you're thinking on the one hand, you don't want to hear anything about anger management, but on the other hand, you recognize you're snapping at people. Your friend is telling you maybe this would be a good thing in the court too. Right, okay. So what happened that the court told you needed anger management?
Well, because I kind of beat up my boyfriend because he pissed me off.
Okay. You beat up your boyfriend because he pissed you off.
Yeah.
What happened?
I don't know. I have like some trust issues, and he says little stuff to me, and it irks me, and I just, so I picked something up and I threw it at him, and then I got in trouble and got arrested and went to court, and they told me I had to take anger management courses.
You picked something up and threw it at him, but then you got arrested.
Mm-hmm.
Did something happen in between the throwing the thing and getting arrested?
A lot of cursing, a lot of screaming.
Okay.
Yeah.
So you threw something, there was some cursing and screaming.
Mm-hmm.
What else?
Yeah. And, I was just angry. Like, I got so angry I couldn't see, and I felt like I've been hurt, so I wanted to hurt him. So, and then he got to the phone and he called the cops and he pressed charges and they arrested me.
I mean, if he was trying to get to the phone to call the cops, it seems like it was pretty escalated.
Yeah, it was. I kind of blacked out, It wasn't good. It wasn't, I don't like, like I realized that at first I didn't think it was so bad, but now I see, like, I scare myself. So I need to get some help with this. Like it's in the relationship, it's when I'm in the house, and now it's like going outside of the house. Like the other day, I snapped at my boss, and I thought she was gonna like fire me on the spot. But she told me to just go take a walk, go smoke a cigarette or something like that. So
what did you do when she said that?
I brought it together because that's my job. You know, that's my job. And I was like, okay, wait, I need to work. So, but then I realized, like, okay, I just like flipped on my boss. So there's some issues that I need to deal with.
So, but in that instance, you were able to pull yourself together.
At that time.
And
At
that was
that time.
because you said you need to work.
Mm-hmm.
So you were worried that if you didn't pull yourself together, you might lose your job.
Mm-hmm.
Okay.
Yeah.
All right. You know, it's I mean, that's a really good example of thinking about the consequences of not controlling yourself, right? So you may have snapped a little bit in terms of snapping at her. You mentioned a little earlier you snap at other people. But it sounds like in these outside situations that you're able to kind of keep control of yourself, keep a level head enough that you can pull yourself back, right?
Yeah, most of the time.
Most of the time.
Yeah,
Okay.
most of the time I get it together. You know, people in the street, they piss you off. I cursed somebody out in the street one time. I was on the train, and this lady, like, she was so rude. She bumped into me, and I wanted to just punch her in the face, but I didn't.
You
So I
didn't.
just nudged her.
So how come you didn't punch her in the face?
I don't know.
You don't know?
I don't know.
What do you think would happen if you punch her in the face?
She could hit me back, or I could black out on her. You know, so the rage, sometimes I don't know if I could stop it, so sometimes I have to hold it back, you know. But it seems like I do that, I can get away with that. Well, this is the truth. I know kind of much who I can get away with certain stuff with.
I see.
So, but now it's starting to be hard to even control that.
Okay. But it sounds like, you know, with the person that you thought about punching in the face, but you didn't. You know, the other thing that occurs to me is there's a good chance of getting arrested if you punch somebody in the face, right?
Yeah, that too.
So, but let's go back to the situation at home. So this is your boyfriend or your husband?
It's my boyfriend.
Okay. So I wonder if this is the first time this ever happened with you and your boyfriend.
No, this is not the first time. This is just the furthest time, you know.
So this is the farthest it's gone. Is this the first time that he ever called the police?
Yes. Yes. Because it's escalated, you know, like I throw stuff at him, you know, I'll mush him in the face and stuff because he's not going to hit me back. But the other day it seemed like he was going to hit me back, and I said, okay. What I did was I grabbed, you know, like with a skillet, cast iron skillet, right? I was going for that, and I threw that across the room, and then I grabbed this, it's like a bookend kind of thing, and I threw it, and it kind of like skimmed him, you know, across the head. But I wanted to hurt him. He pissed me off. I wanted to hurt him.
So one of the things I think is really important to think about, you know, I hear that you're having problems with feeling really angry and pissed off with lots of people, right? And maybe doing little things. But generally speaking, outside of home, you keep yourself in check enough to avoid any serious consequences. So you're not going to do something so bad at work that you'll lose your job. You're not going to do something so bad to a stranger that you'll get arrested, right? But when you're at home, that same sense about not doing something so bad doesn't seem to be there in the same way. What do you make of that?
I don't know. I just get, you know, I get annoyed. Like, I love him and stuff, but he gets on my nerves, and sometimes, like, he doesn't hear me, so I try to make him hear me. He says stupid stuff, and I want to just, like, throw something at him. I mean, it's not right, but it's what happens.
What about that you just said, that you try to make him hear you? So if you are maybe more aggressive, then you'll be able to make him hear you. Is that the idea?
Well, sometimes that's what seems to work.
Does it really seem to work? So it works in that he hears you?
Well, sometimes he does, sometimes he doesn't.
So sometimes it works, maybe sometimes it doesn't work so well.
Yeah.
Okay. What are there any negative consequences besides it may not always work?
What do you mean, like what?
Well, so in the first place, this last time he called the police and you got arrested
Mhm.
and you had to go to court.
Mhm.
So now you have a court case against you.
Yeah.
That's a pretty big consequence.
Yeah. I didn't think he was gonna do that.
Right. Okay, so just in terms of trying to make him hear you, that's a lot to have, that's a big price to have to pay
Yeah.
to try to be heard,
Yeah.
right? What about consequences in terms of your relationship with this person?
Mm. Well, I don't know. Like, sometimes I feel like I don't care if he leaves. Sometimes, I don't know.
But sometimes you feel like you don't care. Does that mean that sometimes you do?
Mm-hmm.
So what would it be like for you if this person left because you were not controlling yourself?
I'd probably be kind of sad. Yeah. I'd be kind of sad, and I try, but like sometimes I can't help it. Like, it's crazy,
Mm-hmm.
and I'll sit there and I'll get this stuff going on in my head, and it won't stop. So I say, okay, I'll be all right. And after a little while, I get so angry that I can't even think straight. Like, no matter what he says, it's all like noise. So, and then I go angry, I go in a dark place, and nothing matters.
Well, but so what makes it so different when you're in a situation with him than when you're in these other situations that you are able to control yourself?
I'm not sure. And I don't know, maybe it's our relationship, or it's a separate from like work or from school or anything like that.
Mm-hmm.
I don't know.
Mm-hmm. Because if your employer
Mhm.
is doing something that's really just grating on your last nerve,
Mhm.
how do you handle that?
Bite my tongue because I know I need to work, and deal with it, and then I'll take that outside. I'll take that anger and put it somewhere else.
Mm-hmm. Where else are you putting it?
I'll take it home sometimes. I'll take it to my friends, and they're just like everybody's telling me like I'm just angry. Like I'm always, like bitching about something, like always. And, I take it from here, take it there, take it there, take it there, take it there. But the one thing I do know is not to mouth off at my boss.
Mm-hmm. So Keisha, there's something really, I think, pretty profound that you recognize that you're taking the anger home,
Mm-hmm.
and that you recognize you're doing that because it's not the same kind of consequence.
Mm-hmm. Yeah, it could be.
And it makes me wonder about, what this relationship means for you, how important it is for you.
Well, it is. I mean, I love him. I try not to, I don't know. Sometimes I get afraid. I get afraid, like, okay, I can't really put it into words. It's gonna sound crazy, but like I'll get afraid, like, okay, if I feel like I must have control, because if I don't, then I'll give him control.
Mm-hmm.
And he tries to run things, so then I feel like, you know what? No, I'm not standing for that.
Mm-hmm.
Then he gets that man stuff, and then I get my woman stuff, and then it's on again.
So it sounds like a tug of war.
Yeah.
Who's got control here?
Mm.
I think that happens, in lots of relationships, and I think that arguing happens in all relationships, and people get angry.
Mm.
But what would it be like to imagine that, it's just as it's not acceptable to act out that anger at work or, in public with strangers, what would it be like to know that that's not acceptable with your relationship partner either?
I guess it would be to not do that with him. That would be good, and I guess he'd feel better about it.
Yeah, he would, but I think it also seems like you would have to figure out this issue of who has control in a different way.
Mm.
What might it be like to talk about that?
Well, I would try,
The question of anger management groups for people who are engaging in domestic violence. One of the things that I think is important for counselors to know and be able to ask clients about is whether or not they had problems controlling themselves with other people besides their partner. A lot of times people will say, well, I don't know what happened, I just lost it, I couldn't control myself. Okay, but is this happening with one specific person, or is this happening with lots of people? If it's happening with lots of people, chances are then the person may in fact benefit from some anger management, although the skills that clients will learn in an anger management program are not going to address issues related to domestic violence, which are different. But if a person is saying that they're just losing it with their partner only, then this is not so much of an anger management problem. They're able to control their anger in other situations. So if they're at work and they get angry, if they're with other people and they get angry, if with authority figures they get angry but they're still able to control themselves, then it's not an anger management problem. So that's why we wouldn't necessarily make that kind of referral.
So, Paul, you're scheduled to go visit your family on Saturday.
Correct.
And we've talked about how in the past there's been some history of violence between you and your wife. So I thought it might be really important and useful for us to talk about things you might think about in order to reduce risk of any violence happening.
I don't think anything's going to happen. I think that I'm perfectly fine now. I
Yeah.
mean, I've done the work. You know, I don't see any problems.
Mm-hmm. So you can't imagine that there's anything that would be useful in talking about things that might come up, how to handle things?
I think that I've done everything I possibly can to keep, things calm and collected. I'm ready to go in.
Mm-hmm.
And now that, I have that opportunity by myself, I'm going to do it.
Mm-hmm. So it sounds like you're feeling really confident about where you're at this point.
Mm-hmm.
Right? So
Mhm.
that's really great, and I'm really glad to hear that. This reminds me a little bit about relapse prevention planning too, though, because you might feel really confident about being able to maintain sobriety when you go out, but part of that confidence is thinking through situations that might come up and how you might handle them so that you don't relapse, right? That's part of relapse planning.
Correct?
Relapse prevention planning. So we want to think about that in the same way here. So I know you're feeling really confident about where you're at in terms of your relationship with your wife. On the other hand, maybe it would be really useful for us to think through, if an altercation were to happen, what are the things that might cause that, and then how might you respond so as to reduce the risk for any violence?
Well, I wouldn't say anything to cause anything.
Okay. Well, can you say that your wife definitely wouldn't say anything or do anything?
I couldn't really say.
Yeah. So it's possible that something could happen, in which case it might be really helpful if you've already thought in advance how you might respond.
Well, I guess I could use a couple of tips just in case.
Yeah. Okay. Great. So just in case. So in the first place, can you think of anything that might be more likely to result in an altercation between the two of you?
Well, if she starts hammering at me again like she usually does,
Mm-hmm.
Last time she blamed me for everything.
Mm-hmm.
She talked to me like, if it wasn't for me, this wouldn't have all happened.
Mm-hmm.
I mean, you stand there and you're blaming me for things. I don't understand why you're blaming me. It's, you should take a good look at yourself.
Mm-hmm. So that can get pretty hard to take.
Mm.
Does that typically happen in front of other people?
No,
No, not so much.
no, she does it. She does it when we're
When you're by yourself.
right.
Okay. Well, I wonder what you think about the idea of having an escort go with you to the visit.
I don't know why I need an escort. I mean, I'm going to take care of what I need to take care of. I
Mhm.
mean, I'm finally getting the freedom to go there by myself.
Mm-hmm.
I don't understand why I'd need somebody else to come with me.
Mm-hmm.
That kind of takes away from me being able to now go there by myself.
Sure. So understandable. So it seems like what you're feeling like is having an escort go with you is a loss of freedom, hard-won freedom.
Right,
Yeah.
right.
Okay. So, in the first place, we can maybe think about it not being a loss of freedom, but it being about something that could be helpful to you and just kind of keeping the situation in a sort of stable, keeping things stable between you and your wife so that the things that might happen when you're alone are less likely to happen on your visit.
I don't know, I'm very much against having somebody come with me.
Okay, so you're not into that idea at all.
No.
I wonder if there are some alternative ideas that might be helpful. Maybe,
Like what?
I don't know, maybe thinking about having a telephone check-in time. So if you're able to call your counselor or the counselor on call that day at certain times to let that person know that things are fine. What do you think that would be like?
Oh, it would be less intrusive.
Mm-hmm. Or maybe what about having a friend go with you to the visit, or maybe another family member be present with you at the like just as part of the visit?
So in other words, they show up for a little while and then they go?
Well, do you think that's something that would be useful?
I guess.
Okay. Is there someone who you can think of that might be a good person for that?
Yeah, I can bring my brother.
Okay. All right. So how do you think that would be to have your brother there at the visit with you?
Well, he knows what I'm going through.
Mm-hmm.
He seems to be supportive.
Mm-hmm.
I don't see why not.
So he may be interested in just being there with you. And
Yeah,
supporting
and, I'll just tell him he'd be there for a while and then he can leave.
Mm-hmm. Okay. All right. So that may be something that could be worthwhile for you to think about. Maybe that would be something you would ask your brother in advance.
Yeah, I would have to talk to him because sometimes he works late.
Mm-hmm.
So that may not be a good time for him.
Okay. All right. So if it doesn't work out with your brother, then it sounds like you're amenable to perhaps calling in.
Calling in, sure.
Okay. That seems like something that's doable for you.
Sure.
Okay. So what about the day of? So either the escort or calling in, you would arrange that in advance, but maybe the day of. I wonder if it would be useful, do you think, to kind of check in with yourself about how you're feeling, if you're feeling angry or upset or tense or just not feeling that good. What do you think it would be like if that were the case?
Oh, right now, I guess I can't foresee what might happen that day, but sure, if I'm not, maybe if I'm not feeling that great, I guess I can, postpone it.
Uh-huh. So you might be able to postpone it.
Mm-hmm.
Okay. And what about your wife? Would you be able to maybe call her before going to the visit and see how she's feeling?
Well, I'd also think that she's also ready to call if she can't make it, but I can call her and make sure she's okay with it.
Mm-hmm. Because one thing, it seems like if both of you are feeling pretty good on Saturday, then that's a good sign. But if one of you, or especially both of you, is feeling pretty tense or just not in a good mood, then it seems like that could potentially lead to some fighting.
Well, on my part, I'm looking forward to this. I don't know what she's looking forward to, but I know I'm looking forward to it. Even if I am a little tense, I believe that I could get through it.
Mm-hmm.
I can't speak for her, but I can speak for myself.
Mm-hmm. Mm-hmm.
I mean, if I'm not really feeling that great, I guess I can, change it to another day.
Mm-hmm. So you're thinking that if you're feeling a little bit tense, that's probably fine. You'll probably
It's
be
normal.
okay anyway.
Yeah, I would say that was normal.
Okay. Well, so maybe we can think about what you might be able to do once you're there if things, start to feel a little bit uncomfortable. What are some things you can think of that might be useful?
Well, probably not talking about things that would make me angry.
Okay, so avoiding hot button topics.
And if she starts talking about something that may not go with me, maybe I can, sit down for a little while and just, maybe change the subject, or I can go take a walk for a little while, or I can just, basically, if she continues to talk about it, maybe I just will cut the day short.
Okay. So you just came up with 3 different possibilities there. So I just want to reflect those back to you.
Mm-hmm.
So one, you said maybe you could change the topic if she brings up something that you feel is just too uncomfortable to really talk about, right? So you could change the topic. If she persists, then maybe you could take a walk. Or if you start to feel more uncomfortable, you could take a walk before things get too tense and uncomfortable, right? Before they start escalating.
Right.
And then after you've tried that, if things are still too uncomfortable where you think that an altercation could really happen, you could just leave and end the visit a little early.
I agree.
Okay. Do you think that's something that you could talk over with her before the visit? So maybe giving her a call?
You mean talking over what, we should not be saying or talking about?
Or, it seems to me that things can come up that you don't necessarily expect.
Okay.
So topics might come up that you're not anticipating. You may not be able to think of all of those on the phone before the visit. But what you could talk about on the phone before the visit is how she can respond when you try to kind of keep yourself in check and under control. So if you say to her in advance, if something is too difficult or uncomfortable for me to talk about right then and there, I might ask to change the topic. Can you do that for me? Can you support me in that?
Okay.
And see what she says. Or if you say, if I get too uncomfortable, I might need to take a walk for a little while, but I'll come back. Will you be all right with that?
Okay.
And if things really get out of hand, then being able to say, I also may need to leave a little early.
Okay.
What do you think it would be like to talk about that with her on the phone first?
It'll be strange because we never did that before.
You never did that before.
So this would be a new experience. I guess it's worth a try if it's going to make things better between us.
So it's different, but maybe it'll mean some improvement in how the two of you get along.
Yeah.
Okay. What else can you think of?
Well, basically talking about good times with her,
Okay.
telling her that, I'm working on myself, like she wanted me to. And just making, the effort to make things better. And, the other thing is if the conversation turns another way, I could just say, I'm really not up to talking about that right now.
Yeah. So you can just let her know. And so if you have some conversation in advance that you may need to do that, and ask if she can support you in that, then that could possibly make it so that an altercation doesn't happen.
I think if you know that there's been a history of violence, you should always just kind of be aware of what's going on with the client on a scheduled visit, before a scheduled visit. So if you know that a client is upset about something that's recently happened in the relationship, maybe they've heard information about their partner, or maybe they had an argument with their partner over the phone, maybe something's been going on. If the partner seems upset or agitated or escalated, then it might be grounds to sit down with the person and say, look, I'm really concerned about this. I want to make sure that the visit goes fine and that both you and your partner are safe. And right now I'm having a lot of concerns.
And I also think that in having those concerns, it's very important for you to be clear and specific before agreeing to that leave and saying, are you going to hurt someone? Are you going to hurt yourself? Right? To be clear and in that message and get and that's a yes or no. Right? To get a yes or no after asking that question, if you have that level of concern. So Robert, we've been talking a few times now since you first came here, and one of the things I like to focus on today is your relationships. in particular how conflicts within your relationship are handled. We ask this of all of our clients just to better understand how we can support our clients through addiction and recovery.
Okay.
So some of the questions that I'm going to ask you are how are conflicts handled in your relationship, particularly focusing on your intimate relationships, not overall relationships. And sometimes in relationships, there can be a lot of power and control dynamics going on. One person accusing the other person of cheating, trying to keep them from going to work, school, church, places with their family. And has anything like that happened in your relationship? Either have you done anything like that in your relationship, or has somebody done anything like that to you?
Well, yes. I just recently broke up with a young lady behind something like that. She kept accusing me of cheating. Every time I went to work or when I would come home, kind of late from doing overtime, I was cheating. And, she was the type of woman that would get physical with verbal language and sometimes like with her hands. She had a very bad problem with her hands. And, as you can see, I'm a big guy, right? And she was kind of like, she wasn't that small, but she was, kind of like a real small woman. Like that, not that small, but small.
Smaller than you.
Yeah.
And how would you deal with it when she would become verbally aggressive with you or physically violent with you?
Well, at first I was on the defensive. I would back away from her, when she would like come at me with the words like, yo, I know you cheating on me, come here, let me smell you, all this and all that. And I would just be like, yo, chill out. There's nothing like that going on. I'm doing overtime, so I'm making money for us. But then it got to the point where she started putting her hands on me. First thing she did was smack me in my face.
I'm going to back up a little bit because we talked about you backing up when she would become verbally aggressive, and then there was this leap into that she would just become physical.
Yes.
So I want to explore a little bit in between that.
Okay.
Okay. So when she would become verbally aggressive and start with the accusations, I've heard you talk about accusations, accusing you of cheating, as well as controlling behaviors like smelling your body.
Yeah.
Right? What would you do in those moments?
Well, I would, just argue, sometimes I would, go on the attack.
Okay.
Like, yo, listen, if you feel as that I'm cheating on you, why don't you just leave me alone, And then it got to the point where, that wasn't enough. Me talking to her wasn't enough, okay? She wanted to actually fight me. So I got to the point where, I fought her back. And it got to the point where cops were called, And, when they came, it was like, you're the man, she's the woman, And I would tell the cops, I was like, well, she attacked me first.
Yeah.
And they would look at her and say, yo, are you serious, dude?
Yeah.
I'm like, yeah, very serious. Because a woman like that is, listen, women are incapable today. Not incapable. They're, unpredictable.
What do you mean?
They're capable of doing anything to a man now. Have you ever seen that movie Thin Line Between Love and Hate with Martin Lawrence and Angela Bassett? When she slammed her head in the door and she had the phone and she called the police and she didn't want him to leave and she would slam her head in the door and the cops would come and she would have this bruises all over her and he didn't even touch her.
Right. And I think with relationships like what you're describing in your relationship, it can be very complicated.
Oh yeah.
So I think people, regardless of male or female, are very capable of doing all kinds of things.
Yes. And she was one of those. She would put on this persona that I choked her. Okay. I said, well, where the fingerprints at? If I choked this girl with these hands, I choked her. Well, where's the fingerprints at? Or, well, she made an accusation that you choked her. I said, I didn't even touch her. But yet I'm being led out the house in handcuffs. I have to leave my home that I pay rent for, that I help pay rent for. I gotta leave my home, you know? So now that's making me feel some kind of way now. Like, this woman is really trying to put me in jail, you know? So now, you know, hate comes into the, no more love, just pure hate. I don't want to be with her no more.
So, Robert, you talked about some, you know, and how long have you been together?
We've been together for 5 years.
So that's a long time.
Yes.
Right? And I'm sure a lot of things have happened over the course of those 5 years, right? Sometimes better, sometimes not as well. That's good, right?
Yeah.
And we're not going to be able to get into the full 5 years, but I think we're touching on a lot of things. And I think you identified words like, you know, hatred, which is a powerful word, as well as being on the attack, right? And those two words, for me, in combination, I'm not excusing anything that she may have done to you or any accusations she may have lied against you, and this is very complicated. But in our discussion today, I want to focus on how you responded to those things, those allegations, those physical attacks against you, because no one deserves to be abused, right? And when you're feeling rage and when you're feeling a sense of hatred towards somebody and you're on the attack, right? So what would your physical violence towards her look like?
Well, I can't demonstrate it, you know.
No, I don't want you to.
But, you know, I would, like, grab her by the hand, you know, and tell her, listen, you need to stop. You need to stop acting like this. You know, you're accusing me of something that is not true. And, you know, it's just that, you know, it's always it's like I'm starting to feel like I need to cheat on her, you know, to make her suspicions come true, you know? And that's me getting back at her. But then I'm not that kind of guy. I don't have to prove that to her, but me just telling her I'm not doing it is not enough. You know, maybe I should give her some proof. You know, like, yeah, I'm doing it, you know, and then, you know, slap her around a little bit and treat her like, you know, like certain men treat their women, you know, discipline them, you know, like, you know, I'm gonna go into a little something like, you know, back when I was coming up, my sister and them was in abusive relationships, and men used to really beat on them, you know, and I couldn't do nothing about it. Because I was young. I was a young boy. And that kind of put that concept in my life that men should discipline their women, you know, physically, you know, make them submit. But when I grew up, I wouldn't practice that, you know, because my father didn't treat my mother like that. Okay. So I didn't have the right to treat other women like that. But some of the women that I came in contact with, they always, I don't know what it is, but they want to physically attack me for some reason. I don't know why. Maybe I remind them of somebody or a past relationship, or maybe that I'm just too nice. You know, I you know, sometimes I, you know, just want to be by myself, you know. And my girlfriend name is Brenda. And Brenda, excuse the expression, is a bitch. Okay? I don't mean to say that, but she was a bitch.
What made her that to you?
The constant nagging, the physical attacks, the calling the police, you know. And now, you know, and cops are quick to, oh my God, women cops are the worst. When they come, they say, oh, but wait a minute, you trying to tell me that you couldn't restrain yourself? Well, do you see the scratches on my face? Do you see the scratches on my arm? Do you see that?
So it's a lot going on.
Yes.
And what I also hear you talking about is not only how you felt about Brenda, but also about women.
Yeah.
And what was modeled for you as a young boy in terms of a belief system that women should be disciplined by men, but at the same time holding on to values that you learned from your father.
Exactly.
So that can really clash. And then you have Brenda, who is being violent towards you. And that's a lot to deal with.
Oh, yeah.
One of the things I think is going to be especially tricky for counselors in the substance abuse treatment program is trying to distinguish between when a client's partner was trying to control the client or they're trying to control the client from using. There are all kinds of situations that we can think of that someone's partner or family member would have every reason and right and desire to try to prevent the client from using. And they may be doing all kinds of things. They may be saying things like, I don't want you hanging out with those people. I don't want you going to those places. I don't want you going out by yourself late at night. I don't want you doing X, Y, or Z. In most situations, or rather in a non-addiction kind of situation, we might think of those as being very controlling behaviors. But certainly when someone is abusing drugs or alcohol, there's really important reasons why their partner or other family member doesn't want them doing certain things. One of the ways that we can think about it is, how far are you willing to go?
And that becomes the distinction, where it becomes me wanting to protect my loved one, my family member, my spouse from you using drugs, to I'm going to control you. And really understanding what tactics does in this case, the abusive partner use to control that person from going places, from seeing from access to money. When does it become from wanting to protect you to being controlling over you? And I think part of that is really understanding the history of the relationship. And has it always been this way, or is this a new behavior?
Right, because I would just say, like you said a minute ago, the abusive partner, in that kind of situation, we may not know whether or not a client's partner is actually being abusive, or they're actually trying to prevent the client from not only getting high, but also using up all of the money or leaving the kids alone in order to get high. So it could be that they're trying to control the addiction, not trying to be an abusive person.
And I think then it becomes a responsible conversation to have. So what are your strategies in doing that?
Right.
Because if you lock me inside the house, if you chain me to the steam, if you do those kinds of things and it works, and I don't use this time, then that becomes a strategy that worked. And are you going to do that again? Again, going back to the question of how far will you take it? So then we have to then have those conversations about, is this an abusive tactic?